My name is Graham Walker. I'm studying psychology through the University of New England, and part of our behaviour modification class is this video on a technique to do with behaviour modification. What I have chosen is an exposure technique for anxiety and panic attacks. These ones is a gradual exposure through the feelings, the sensations, which during the early stages of anxiety and panic attacks manifested without people knowing where they come from. The first technique I will demonstrate is a hyperventilation one. This one will do for a minute, and it's simply short, shallow breaths, chest breathing in and out, going. When people have an anxiety attack or a panic attack, they quite often aren't in control of their breath, and they're very short, shallow breaths that make it hard to get enough oxygen. These feelings can really make a person feel really uncomfortable and add to that feeling of dread that can be suffered during a panic attack. So we do these for a minute and let ourselves calm down afterwards before we try the next one. The second method is slightly shaking the head from side to side. This simulates not necessarily what happens during a panic attack, but the feelings during it. So I'll take my glasses off. So this method's just sort of shaking, and it disorientates the brain, disorientates the vision, and that contributes to the feelings during a panic attack. This one we only do for 30 seconds, and afterwards we let ourselves calm ourselves back down and get back to like a baseline level. The third method is sitting on the ground with our head between our knees, far down. This simulates the blood rushing to the head, and this can make that full feeling in the head. And when you're having a panic attack or anxiety attack, it simulates that sensation. The fourth method is a muscle tension one. You can do it in different parts of the body. I've chosen to do it in my head and my neck, because a lot of people, that's more closer to the brain, so you feel that as more to the person, whereas if you did it in your legs, it's sort of dissociated. So you sit there, focus on a spot, and just tense up, like clench your jaw. When you do this, it can be quite hard to breathe, so we only do it for 30 seconds, and that way it simulates part of the panic attack. People with clenched jaws. Over time, with clenched jaws, you had all the problems with migraines, stress headaches, and that can bring on panic attacks when the people can feel it. The sixth method is holding your breath. So you sit in one spot and just hold your breath for 30 seconds. Quite a simple one, but again, it simulates during a panic attack where people can hyperventilate from, like the first method of hyperventilating, shallow breaths. Sometimes during a panic attack, holding breath and becoming shorter breath can happen, so doing this simulates that procedure. The seventh method is spinning. I've seen people do this standing up on grass, on carpet. I find it dangerous. This one simulates the dizzy feeling, and I recommend doing it on a computer chair. All it is at a gentle pace, not too fast to fall off, just spinning around in circles. Focusing on the one spot. Now you would do that for a minute, and you have that dizzy, lightheaded feeling. Now, it is important to do it in a safe area and to not overdo it. The eighth method is very short breathing through a straw. Put it in the mouth and just breathing in through that. That simulates the difficult through breath that some people can have during a panic attack. It's important that it's clean straw, but that's about the only danger to it. This method simulates the very short breath, the hardness it can have when the panic attack, when you're feeling the whole chest coming in. The ninth method is chest breathing. When you do concentrated breaths, slow breathing, generally it's right down the abdomen. The chest doesn't move, so it's hand on your belly and you can feel it going in and out. With chest breathing, it's very short, and with anxiety attacks, the breathing's very fast and quite often right up here. So your hand on your chest, it's just, you can focus on moving your chest. It's quite a strenuous thing to actually breathe through your chest, and people who breathe through the abdomen, which is a more relaxed feeling, feel more relaxed. So this way of breathing through the chest simulates the chest breathing during an anxiety attack. 10th method is staring at a spot. This spot's a spot on the wall or a spot on the carpet. Keeping your head still, body still, breathing regular, and just focusing on the spot. During a panic attack, the focus is very intensely on something, and there's the thought processes that go on during that. What part of the snowballing effect. So staring at the spot, regular breathing. The importance with all this is that it's gradual. You don't want to push someone through hyperventilating when they're already in a panic state or the heightened anxiety. Quite often people with anxiety, when you start these methods, they've already got their baseline's higher than the average person. Average person might find these funny to do. Kids would do it, everyone would run around being silly. Someone with anxiety, especially if you're there in the room with them, they have already got that focus that something's going on. So important thing is to be comfortable clothes, especially because you're sitting down and moving around, in a safe area. It's also important to have a break in between each one so that you come back towards a baseline. Over time, you can decrease those once the person's starting to become more accustomed to the feelings. You use this during a panic attack. The person can use it during a panic attack so that when they suffer from, they start the feelings of hyperventilating, they know what's happening, they're aware, and so using a breathing method like mindfulness breathing or other methods that become that center a person can be put into place. Knowing that these problems are happening, then you can stop them from getting worse. Thank you.